Hello, good evening. Good evening,
Good
Dr.
evening to
Watson.
you.
How are you today?
I am well. I'm inside. It's relatively warm. I was
Yes,
outside earlier. It was cold and windy, but I am here and I'm feeling blessed.
yes, and highly favored and flavored. That's great.
Yes, all of
Okay.
that.
I want to say I'm happy that you're here. You're joining the team here this evening, and we are excited to have someone of your caliber here in the nursing profession. You know, we are celebrating Black History Month. And
Yes,
I know there are
definitely.
many Black nurses around who have been contributing to this noble profession. Black History Month reminds us of remarkable individuals who have aided in shaping and strengthening the nursing profession. And you're definitely one of them. I know you have been contributing in different ways, in different capacities to the nursing profession. And I want to say thank you on behalf of the team of Empowering New Nurses. I'm Dr. Miriam Smith, the host for Empowering New Nurses, and I consider this a privilege. And I'm thrilled to have you on board. I know you have something to say, but as we celebrate this Black History Month and this noble profession, I would like you to tell us just a little about yourself as a administrator, as a nurse educator, and all the other things that you have been, you know, so blessed to be a part of.
So once again, it's another privilege to join you on this platform to share the nursing profession and to encourage and empower other nurses who are in the profession and individuals who are considering becoming part of the profession. This is one of the best professions that anyone could choose. And for about 20 something years, I forgot the exact number, nurses have been number one as the most trusted profession.
Yes.
So I I loved learning about the human body, anatomy and physiology as a child. And that is kind of what drove me into the nursing profession.
Thanks very
Also,
much.
I grew up on a farm. As far as I can remember, I was caring for animals, and that just transitioned into caring for people.
People, that's great.
So it was like a natural transition. I want to care, and that's what nursing does. We care.
We care. Yes.
So I went to University of the West Indies College School of Nursing. I got my diploma there in graduated in 1990, migrated to the United States in 1991. While working in Jamaica, I worked in the Department of Ophthalmology at the University of the West Indies. And then when I came to this country, I wanted more of an ICU setting. And so I got sent to work in the NICU.
Mm,
And I consider my years of caring for animals as a way that prepared me for working with patients in the NICU. Because in the NICU, your patients can't tell you what's wrong.
mm.
You have to read them and figure out what's going on with them. So I think it may be some people might not consider this a good similarity to make, but I do believe there's some similarity between caring for animals and caring for babies, because neither of those population can tell you what's going on with them.
Thank you so much. Thank you so much
And
for sharing that.
yes, and then following that, yeah, while doing that, as a matter of fact, I got into nursing education. Um, I first started out with doing things at work like being the super user on certain pieces of equipment and would
Mhm.
train other nurses on that. Became a BCLS instructor, a neonatal resuscitation program instructor, and doing other things as far as that go. Then I got into management, first as a head nurse, then as a nurse manager. And then I moved on to work for the city hospital system as the associate director of women's health program, dealing with not just babies, but mothers and babies for the system. Um, and then moved into quality.
Mhm.
And so that's where I currently am working. I am the associate director for quality management at my facility.
Great, great. So you have you're a resourceful person indeed, and we are happy to have you on so that you can share as you have shared with our young nurses that the sky's the limit and they can keep going because there are so many different areas in nursing that they can find their niche. And then in so doing, they can give that expertise, that care that each patient deserves in their specialty. But
Yes,
I
the
know.
sky is definitely the limit.
Yeah, because man, Dr. Watson, when I was growing up, I must say that there were so many, we never had so many areas of nursing
Mm-hmm.
to specialize in.
Mm-hmm.
Most in my time, my early time, it was less like midwifery. It was
Yes.
like critical care. It was like renal care. Those were the operative care. It was, but now the nurse can become a specialist. The nurse can become a nurse anesthetist. The nurse can
Mm-hmm.
go into education.
Mm-hmm.
There are so many different
And
areas.
if they like computers, now we have nurses
Informatics.
and yes,
Exactly.
nursing informatics,
Exactly.
you
And
know?
as we advance in the nursing career, you know that nursing is both a science and
Mm-hmm.
an art. Technology has taken over
And
so much, and we have to
also,
learn technology. We have to
mhm.
learn it's vast.
And also, when I started, I just know of us becoming RNs. I didn't know anything about nurse practitioners,
Right.
so
Mm.
that was another way that we
Evolved
advanced and
and advanced.
evolved in our
Yes.
practice.
Yes, so we want to say, as we celebrate Black History Month, we're going to say thanks to all our nurses. But at this moment, we're going to say to our Black nurses
Yes.
because they have they have transitioned, they have explored, they have adopted. Because if I should ask you some stories, I'm sure you'll be able to tell me some negative part. But thank God we have passed that and we continue to grow and give each patient high quality care. It doesn't matter their race, it doesn't matter their religion, it doesn't matter their sexuality, it doesn't matter. As a human being, we care
We
for
just care.
individuals and we offer
Mhm.
compassionate care. But I know that during your time of nursing, you have met some nurses that have impacted you in so many different ways. And you want to maybe highlight somebody this evening who their legacy has helped you so much, or you're heard of, or but it has impacted in such a way the nursing profession to stand out. And you would implore and you'll beg new nurses to embrace those qualities or the legacy of such nurse. Do you have somebody in mind?
I have somebody in mind, but before I talk about her, I want to say that at one point I used to hear this phrase, and I'm fairly certain that you have heard that phrase.
Nurse?
Nurses eat their young.
I've heard it. I've heard it
Yes.
repeatedly, and not
And
just in
I
one
didn't
place.
want to be one of those nurses. And I can say, thank God, many of our Black nurses and nurses of other races that I've encountered were not those kind of nurses. They were nurses who wanted to see the profession grow and who wanted to really, really care for people and have that compassion that you spoke about. And so There's this one lady that I wish to highlight today. Her name is Dr. Michelle Malcom-James. I met her in 2014 when we were both working at the same facility. She had dual roles. She had a role as a clinician and also as an administrator.
Mm.
She was a nurse practitioner, and so she did clinical practice as a nurse practitioner, but she also managed the other nurse practitioners within the facility.
Wow.
She was, and I'm saying she was because unfortunately, Dr. Malcolm-James passed away suddenly last year.
Sorry to hear
Um,
that.
it was a big loss to the nursing profession, I feel. But Dr. Malcolm-James was a very humble person. And it's the humility that I loved about her. That was one of the things. She was also a very, very intelligent, very smart woman. And she was a compassionate person. She looked to have other nurses develop the best qualities that they could develop. She encouraged others. She lived a simple life in the clinical area that we saw. She she did so many things that I am only learning about after her passing because
Wow.
she was so humble.
Thanks so much for sharing that. And you know what's interesting? Would you consider her a transformational leader?
Yes, she was definitely a transformational leader. Um, you have the leader who is my way or the highway kind of
Right.
leader,
Right.
and you have the leader who, okay, do what you want, leader. But no, she truly sought to guide the people
Great.
she led, um, and give them an opportunity to grow,
I
to
love that.
use their own initiative without being laissez-faire kind of leader. So, in that sense, I saw her as a truly transformational leader.
Thank you so much. And we just want to honor her on this platform, the Empowering
Yes.
New Nurses, because we acknowledge that there are so many talents out there in our
Mm-hmm.
young nurses. And many
Yes.
of them have so much to offer. They might be new to the profession, but they themselves have brought some freshness and some
Yes.
newness. And
Yes.
with technology, doctor,
Mm-hmm.
we know that many of them have that down pat.
Yes.
Many of them.
Now, my when I came into nursing, I knew what to type. That's about it was I was a seasoned nurse, so to speak, before I ever put my hands on a computer. And today's nurses, especially the very young ones, they're coming in with all of that computer skill.
Hmm.
And our equipment, actually, that we're using on patients, monitors, and other things, are incorporating more of computer technology and other kinds of technology that our nurses have to use in the care of patients. And so they're bringing that with them. It's not a new set of skills that they have to learn, as it
Hmm.
was in my case. I had to
Right,
learn all of
right.
these new
Hmm.
skills. So they're bringing those skills in with them, and they are having innovative ideas as to how to use the technology that we now have and that continues to be developed to enhance patient care.
Yes. And so we rely heavily on that today as
Mm-hmm.
opposed to my time. And that will help with the assessment, it helps with the treatment modalities, and of course, they have so much in that to offer. And many times, and I say this in a humble way, there are many times some of the baby boomers, like
Mm-hmm.
myself, are more challenged with that.
Yes. Yes.
However, that's why it's important for us to work together because one skill enhances the others and we benefit from each other. And that's how it ought
Definitely.
to be. That's how it ought to be. So I want to tell you thanks for highlighting, and I want you to say it clearly. Dr.
Michelle Malcolm James.
Thank
A
you so much.
lady who came from humble beginnings, was born in Kingston, Jamaica, grew up in Manchester, went to school in Manchester, then moved to the United States where she furthered her education. She had a passion for learning, a passion for sharing her knowledge, and a passion for caring for patients. And so I want to honor her at this time, and she will always be someone that I remember.
Thank you so much for sharing that. In addition to what you have just said, there was a nurse that I admired so much also, and she was a black nurse, and she was from Maypen, she was from Clarendon,
Mm-hmm.
and I worked with her at New York Presbyterian some years ago. She was trained in England. And back in those days when the English nurses return home, they either come in with a midwifery or some critical care in addition to other their registered being a registered
Yes.
nurse. And so I admired her. Her name was Miss Ruby. We called her Miss Ruby, but she was Miss Ruby Robinson. But she was such a dedicated nurse. She was so caring and she would impart her knowledge. And being a
Mm-hmm.
younger nurse at the time, she would share her techniques, her gems, her little nuggets for you to give that quality care, that high quality care that all patients could be satisfied. I will never forget her. And she lived in the Bronx, but she was such a resourceful person, and yet she was so humble. You know, she was loved. Unfortunately, she died tragically. But I will never forget Miss Ruby. And so, on this line, as we are about to finish, what what would you say to a young nurse who might be feel like um, she or he want to just cop out or quit nursing because it can be so challenging at times? Don't you agree with me? It's a beautiful profession, but it can be challenging at times.
It is a beautiful profession. It is often very challenging. And it's not just the challenge of the patient care, but it's that you are working with diverse people from diverse backgrounds,
Yes,
um, across generations at times, right? And we each bring to the profession our own unique set of skills, our own unique backgrounds. And so we have to meld those together and work together. So, it's a matter of understanding each group and figuring out how best to deal with each group, right? So the baby boomer is going to be different from the Gen Xers and
X,
whatever else
Y.
group that there is. But having an understanding and a respect for
Yes,
each other
yes.
is what's really going to help us with some of these challenges.
Thank you so
If
much,
there's no
Dr.
respect,
Watson.
the
Thank you so much.
challenge is going to remain.
Thank you. Thank you. Thanks so much for coming on the Empower New Nurses show. And we have learned, and my audience, we are grateful that you came on and you have listened and you have shared. And I know our young nurses are there, many of them. So we want to say congratulations to those who have just recently passed their NCLEX and the sky's the
Congrats.
limit.
Yes.
We are proud because as I leave, the baton is being handed on, and as Dr. Watson leaves, the baton is being handed on to someone. So this noble profession, continue to be outstanding. Thanks again for coming on.
And
And
you know what I think, Dr. Smith? Um, as we get older,
yes,
we are going to be needing these nurses to care for us.
Yes, yes,
So we need to empower them because they're going to be our advocates when we can't advocate for ourselves.
beautiful, beautiful, beautiful ending. Now, how can you and you and you connect with this program? You can connect with me on YouTube at Miriam Amanda Smith. Now on Instagram, it's Podcast Mayor. And on podcast is Empowering New Nurses. Share this with your friend. Subscribe. This is important. Subscribe, share, comment, and thumbs up. We do appreciate you. Have a blessed day. Have a
So
blessed
two
day.
thumbs up.
Thank you, Doctor. Anytime. I look forward to having you again in 2025. Thanks
All
for
right.
sharing.
I
And
will
those
be
who all
honored when you invite me again.
Thank you. Those who know Dr. Michelle Malcolm-James,
Malcolm-James.
let's keep the light burning, the legacy of her light. And those who knew Miss Ruby Robinson, who's a private duty nurse in her capacity, who cared for so many individuals with love and compassion. May her legacy lives on in what we do for others. Thank you so much. Bye.
Thank you. Thank you.